If you are over 65, this video may help you avoid tests that sound very reasonable but may not actually be necessary for you. Health checkups are necessary, but inappropriate testing can lead you to treat conditions that your body may never have needed to fear. The first thing I need to make clear is this. Not every test on this list is bad. Some tests are very necessary, but the problem lies in how we use them. Below are 6 checkups that should not be performed routinely if you have no symptoms, are not in a high-risk group, or have already been adequately screened in the past. 1. Routine colonoscopy after age 75. In general, colorectal cancer screening has clear benefits for people between the ages of 45 and 75. From ages 76 to 85, the decision to continue screening should be individualized. What is your overall health like? Have you had a colonoscopy before? Have you ever had high-risk polyps? What is your life expectancy? And what does the patient personally want? Why should we be more cautious after age 75? Because colonoscopy is not entirely simple. Older adults may experience dehydration and electrolyte imbalance during bowel preparation. There is also a risk of bleeding, bowel perforation, or complications related to sedation. But there is one very important point. Do not ignore warning signs. If you have blood in your stool, iron deficiency anemia, unexplained weight loss, a persistent change in bowel habits, unusual abdominal pain, or a history of high-risk polyps, you should see a doctor. What I want you to remember is this. After age 65, colorectal cancer screening may still be necessary. But after age 75, colonoscopy should be an individualized decision, not something done automatically out of habit. 2. Carotid artery ultrasound. When there are no symptoms, many people think that carotid artery ultrasound is a good way to prevent stroke. It sounds very reasonable, doesn't it? Since the carotid arteries carry blood to the brain, checking for narrowing may seem like a way to prevent a stroke. But in reality, if you have never had a stroke, have never had a transient ischemic attack, and have no neurological symptoms, this test generally should not be used for mass screening. Why? Because ultrasound may detect a narrowed area, but not every narrowing will cause a stroke. An abnormal result may lead to angiography, medications, vascular intervention, or surgery that may not be necessary. A more effective way to prevent stroke is to control the real risk factors: blood pressure, blood sugar, cholesterol, smoking, physical inactivity, atrial fibrillation, and taking medications as prescribed. What I want you to remember is this. Do not get a carotid artery ultrasound just to scan for stroke risk. Focus on controlling the factors that truly reduce your risk of stroke. 3. Routine electrocardiography, stress testing, or cardiac imaging when there are no symptoms. Cardiovascular health is a major concern after age 65. That is absolutely true. If you do not have chest pain, shortness of breath with exertion, fainting, abnormal palpitations, or known heart disease, these tests may produce false positive results. And when there is a slightly abnormal result, you may be drawn into a chain of further testing, additional imaging, more laboratory tests, invasive procedures, medications, or treatment that may not truly be necessary. The better approach is to control cardiovascular risk factors: blood pressure, cholesterol, blood sugar, body weight, sleep, physical activity, smoking, and diet. What I want you to remember is this. Advanced cardiac testing should not be done simply because of anxiety. But if your body is sending unusual signals, do not delay. 4. Having a DEXA bone density scan and then automatically taking long-term medication. First, I want to make this clear. A DEXA bone density scan is not a test to avoid. For many people over 65, especially women, DEXA is a very useful test. It helps detect osteoporosis and assess fracture risk. But what I do not recommend is this: having a DEXA scan and then automatically taking long-term osteoporosis medication simply because the result shows that your bones are somewhat weak. Why? Some osteoporosis medications, especially bisphosphonates, can cause stomach irritation, esophagitis, musculoskeletal pain, or may be unsuitable for people with severe kidney disease. More rarely, long-term use may be associated with osteonecrosis of the jaw or atypical femur fractures. These complications are uncommon, but they are the reason these medications need to be used for the right indication and monitored properly. In addition, if we look only at a DEXA number and rush into medication, we may miss other important causes of weak bones, such as vitamin D deficiency, hyperthyroidism, kidney disease, long-term corticosteroid use, malnutrition, or fall risks at home. If these causes are not addressed, medication alone may not protect you as well as it should. What may be more important is weight-bearing exercise, balance training, fall prevention, adequate calcium intake, vitamin D supplementation if deficient, and regular follow-up. What I want you to remember is this: DEXA helps detect fracture risk, but a DEXA result should not automatically turn you into someone who has to take medication for the rest of your life. 5. Overly aggressive prostate PSA testing and mammography in low-risk individuals. I want to be clear. PSA testing and mammography are not bad tests. They can be very useful when used for the right person, at the right age, and with the right level of risk. The reason is that many glandular cancers in older adults grow very slowly. In some cases, cancer may exist for many years without causing danger during the remainder of a person's life. But once it is detected, the patient often has to move into a chain of further evaluations: additional imaging, biopsy, monitoring, surgery, radiation therapy, or medication. In low-risk individuals, this chain may sometimes cause more anxiety and side effects than real benefit. What I want you to remember is this: after age 65, especially after age 70, do not get a PSA test just to check for peace of mind if you do not yet understand the benefits and risks. 6. Whole body CT or MRI to screen for every disease. Whole body imaging sounds very appealing. With just one scan, you can look throughout the body and detect disease early. But for people without symptoms, this is usually not a good screening choice. Whole body CT involves radiation exposure. It can also detect small abnormalities that are not dangerous. Whole body MRI does not involve radiation, but it still has a major problem: incidental findings. The human body, especially after age 65, has many benign changes: a small nodule, a small cyst, or an area that looks slightly different. Most are not dangerous, but once they are seen, they are often difficult to ignore. Then come more scans, more tests, biopsies, prolonged monitoring, anxiety, and expense. CT, or MRI, should be used when there are symptoms, abnormal findings on examination, a need to monitor a known condition, or a clear medical indication from a physician. What I want you to remember is this: good testing is not whole body scanning. Good testing means the right test, in the right place, for the right reason, at the right time. So what should you check after age 65? After age 65, you should still have regular health checkups. But instead of following a long list of tests, focus on what is truly useful: blood pressure, blood sugar, cholesterol, kidney function, current medications, fall risk, vision, hearing, vaccinations, oral health, memory, mood, sleep, nutrition, physical activity, and osteoporosis risk. Before having a test, ask your doctor 4 questions. What disease is this test looking for? Given my age and health, what is the real benefit for me? If the result is abnormal, what is the next step? If I do not have this test, is there a safer alternative? A good doctor will not be bothered by these questions. This is how you and your doctor make the right decision for your own body. After age 65, the most important thing is not to have more tests. The most important thing is to have the right tests. Do not skip checkups. Do not be afraid of testing, but do not let yourself be pulled into tests that do not have a clear purpose.